Thalassemia is a group of inherited blood disorders. It affects the production of hemoglobin. Hemoglobin is a protein found in red blood cells. It carries oxygen throughout the body. People with thalassemia don't make enough hemoglobin. This can lead to anemia, fatigue, and other health problems. Thalassemia is a lifelong condition. However, with proper management, people with thalassemia can live full and active lives. Early diagnosis and treatment are crucial for managing thalassemia effectively. The severity of thalassemia varies greatly depending on the type and how many genes are affected. Some people with thalassemia have mild or no symptoms. Others may experience severe anemia and require regular blood transfusions. Understanding thalassemia is the first step towards better management and support for those affected by this condition. As we delve deeper into the types, symptoms, diagnosis, and treatment options, we gain a comprehensive understanding of this complex blood disorder. There are two main types of thalassemia: alpha thalassemia and beta thalassemia. Alpha thalassemia affects the production of the alpha globin chain of hemoglobin. Beta thalassemia, on the other hand, affects the production of the beta globin chain. The severity of thalassemia depends on how many of the globin genes are affected. For example, a person with alpha thalassemia trait has two affected genes. They may have mild anemia or no symptoms at all. However, a person with alpha thalassemia major has four affected genes and will have severe, often life-threatening anemia. Symptoms of thalassemia can vary depending on the type and severity of the condition. Common symptoms include fatigue, paleness, shortness of breath, and jaundice, which is the yellowing of the skin and eyes. In severe cases, thalassemia can lead to bone deformities, organ damage, and even death. Early diagnosis is important for managing thalassemia. Diagnosis usually involves a combination of blood tests and genetic testing. Blood tests can check for anemia, abnormal hemoglobin, and iron levels. Genetic testing can identify the specific gene mutations that cause thalassemia. Prenatal testing is also available for couples who are at risk of having a child with thalassemia. This testing can be done during pregnancy to determine if the fetus has inherited the condition. Prenatal testing options include chorionic villus sampling, also known as CVS, and amniocentesis. Section 4. Treatment options for thalassemia. Treatment for thalassemia depends on the type and severity of the condition. For mild cases, treatment may not be necessary. However, people with more severe forms of thalassemia may require regular blood transfusions to maintain healthy hemoglobin levels. Another important treatment for thalassemia is iron chelation therapy. This therapy helps to remove excess iron from the body, which can build up as a result of frequent blood transfusions. Iron overload can damage organs like the heart and liver. In some cases, a bone marrow transplant may be an option for people with severe thalassemia. This procedure involves replacing the patient's bone marrow with healthy bone marrow from a donor. A bone marrow transplant can cure thalassemia, but it is a complex procedure with risks. Section 5. Living with thalassemia. Living with thalassemia presents unique challenges. However, with proper management, individuals with thalassemia can lead full and active lives. Regular medical checkups, adherence to treatment plans, and a healthy lifestyle are essential. Support groups and online resources can provide valuable information and emotional support for those living with thalassemia and their families. Connecting with others who understand the condition can empower individuals to navigate the challenges and live their best lives. Research continues to advance our understanding and treatment of thalassemia. New therapies, such as gene therapy, hold promise for potentially curing this complex blood disorder in the future.